Welsh County Government's policy on chronic diseases is to increase awareness, is to ensure that it is a fundamental part of our future planning. It affects many people, and particularly older people. Some people over the age of 65 might have 3 or more complex chronic diseases. It's very debilitating for the person. It affects their quality of life, and if we don't approach it in a proactive way, then we'll have greater difficulties in terms of dealing with patients who will break down and find themselves sometimes in a necessary hospital setting. That's not good for the patient, it's not good for the health system.
The management of chronic conditions is changing, I think, beyond all recognition. With the Chronic Conditions Management project, the way that people are being brought together and the focus on delivering a joined-up care and service to the patients and their families is really having a dramatic impact on how we deliver our services. One of the key drivers with the reorganisation of health in Wales is about getting us to work closer together and to support each other and get the most for the people of Wales.
The demonstrator has shown the need to push the boundaries and try and test new initiatives. All agencies have a part to play in the management of chronic conditions. It affects everybody, and all agencies will be part of the solution for that. It's not one agency working independently, it's everybody working together to tackle the issue.
The number one benefit that the demonstrator has brought is better quality care and service to the patient and to their families. That's without doubt.
The aim is to take patients with chronic conditions and make sure that the services that we give them are actually appropriate to what they need. And if they can manage their services better, then hopefully we can keep them out of hospital. They will have confidence that they know exactly who to contact about things, and it's going to improve their lives.
This project has in some ways been a driver for change to actually make us change our whole community services. We've got a group of people who are passionate, excited, committed and talented, working together to try and change services to be better for people.
I think by doing this in a very sensible, structured way, we can improve their health remarkably. This is the demonstrator site. I hope that this is successful and can be rolled out then throughout the country.
If you're receiving care in your home, you might have someone in health come and visit you in the morning and someone from social care come and visit you and do very similar things. Actually, integrating our services means you might have just one visit instead of 2. You don't want to have to deal with our organisational differences. You just want the right care in the right place by the right person.
Locality teams have been a key component of the demonstrator site. Using existing frontline staff, we have created locality leadership teams. In those locality leadership teams, we've got GPs, nurses, local government social services staff and the voluntary sector. And as a core team, they're able then to spend time together identifying how they can assess and plan and deliver more care closer to home.
This new community model is going to allow us to bespoke services to the individual needs of each of these communities and so make them more accessible, delivering the service to the patient.
I think it's very exciting to be part of a change in practice that's going to be whole scale and could have real advantages for both patients and healthcare professionals.
We're very confident that we will be able to demonstrate that it's acceptable and indeed preferable to patients and professionals, and also patients, carers and families. So really, without the demonstrator site, we couldn't implement this community model. It's essential to us.
Really what we're trying to do is have a portfolio of responses that are available to service users so that they only have to dial one telephone number to access help, and so that there's a range of options available to them so that they will be able to receive improved care at home, maybe more physiotherapy at home, more social services input at home, generic workers being able to look after some of their social care needs as well as their healthcare needs. And by providing this underpinning and improving patients' confidence in the system, we should be able to reduce unnecessary admissions to hospital and to residential care.
There's a number of projects ongoing as far as the demonstrator is concerned. First and foremost, at the bottom of the chronic conditions triangle, we've got clearly the public health agenda, self-management of patients, and pharmacists are very much involved within North Wales around focusing on the behaviour of the patients, forming that intermediate team around medicines management, and actually getting the best from primary and the best from secondary to combine together around making it safer for the patient. The demonstrator really is giving us that opportunity to formalise those links between primary, secondary, community care, but also to actually forge those links with local authorities. And so a significant number of our patients and citizens that clearly live in care home settings and clearly at home, and it's actually enabling us to actually reach out the workforce that we have, the very skilled workforce, and bring out of the traditional hospital setting out into the community.
We've looked at supporting obviously the workforce, because the workforce is working very, very hard at the moment, but not always smart. So we've looked at developing the role of a support worker, and they have very close links with the patients, obviously, with the families, with the carers. So we've tried to look at what feasibly the support worker could do to relieve the pressure on the trained nursing staff.
If you speak to most patients who have a chronic condition, they'd like to stay at home and be able to receive their care there, and utilising telehealth, we can do that in a much more efficient and suitable way. First of all, the patient doesn't want to visit if they're well. They want you there when they need you, so that's one good way of reducing the visits, but it also enables us to see a lot more people, because then we can see the right people at the right time in their home, which for them is the right place.
It is reassuring, because you know that if anything is wrong, they will pick it up and either come and see you or notify you when you're through the machine. The virtual clinic is a name we gave to a system whereby a consultant would go to a number of GP practices, not to see patients in person, but to discuss patients around a table with the GP. I think we've learned that these clinics can be very successful. We've certainly avoided a good number of referrals by doing them. I think the demonstrators being key in this, and the fact that the Welsh Assembly Government are behind us trying to change the way we do healthcare has been of huge benefit.
So all in all, it really is driving a new way of thinking in both health service delivery and in joining up with local authorities and other partners.
This improvement process is all about benefit to service users, and I would hope that they are already seeing changes.
Long term, in terms of what we're going to see in Carmarthenshire, is that we'll be able to provide more services, particularly to older people in need in the county, by using our resources to best effect. Rather than duplicating and having people doing essentially the same job in the same streets, they'll be working together to make sure that they provide a range of services that perhaps at the moment we've not been able to provide.
It was nice for somebody like myself as a layperson and a patient to see the way they were going, and it's nice now that a year and a little bit on to be able to see that what was identified as what they needed to do is now not only in place and in practice, and they've designed the practices that they are employing today, but also they've fine-tuned what they are doing.
The most enjoyable thing about working with the Demonstrator project is that they've helped us to focus on the outcomes, not the progress of making changes. I don't think we would have done that without the help of the Demonstrator team. They've enabled us to all get together, put forward our ideas at our very low cost.
I think we've already started to see some benefits in the health and well-being of people in the community, patients, clients of social services. We've seen a reduction in the numbers of people going into residential care, for instance. We've seen general improvements in people's general health and well-being. And we've also seen satisfaction rates go up.
If I had to summarise a key message from the Demonstrator project, I would say it is about delivering services where they should be delivered, at the right time, the right place, by the right people.
Put the demonstrator sites in place in North Wales and Carmarthen and Cardiff to start to learn in terms of how you need to do things differently, do things in a partnership way, be much more proactive rather than reactive. But what we need to do then is to roll that out throughout Wales, so we universalise best practice.